There are many barriers that affect healing of wounds. Gently wipe them away with the all-in-one UCS Debridement cloth from Medi. Wound debridement at an early and appropriate stage is likely to accelerate wound healing and improve patient care. The UCS debridement cloth is unlike any other debridement product on the market. Each cloth is pre-moistened with a solution that contains a skin-friendly surfactant and allantoin that softens hardened dry skin and cleanses deep into the wound bed. It is ready to be used straight from its pack. The non-woven viscose cloth is effective in debriding wounds, whilst the solution cleans and hydrates the wound bed and the peri-lesional area. Here's how it works. The UCS pre-moistened cloth softens necrotic tissue, plaque, fibrin and slough, trapping debris and biofilm in its fibres as it moves, effectively cleaning the wound bed and providing a healthy environment for the wound to heal. The UCS debridement cloth is gentle on patient's skin, helps to reduce the odour of wounds, and is used to clean and hydrate the whole limb. UCS is safe and easy to use by both medical professionals and patients themselves, and it does all of this while supporting the healing process. The UCS debridement cloth can be used across all clinical settings for the debridement and cleansing of acute and chronic wounds, peri-wound skin, skin conditions, and static wounds to remove suspected biofilm. UCS can also be used as first aid when cleaning trauma wounds. Each cloth comes in an easy-to-open sterile foil pack and is supplied in boxes of 10. The UCS debridement cloth. Debridement made cleaner and easier.